Hello, my name is Dr. Latanya Benjamin. I am a board-certified pediatric dermatologist. I'm also a mother to a very active and happy 5-year-old daughter. Most mothers think breastfeeding should come naturally, but it actually takes time, practice, and patience to get right. I'll walk you through some common questions new mothers have, like how can I tell if my baby's hungry? How often should I feed my newborn? How do I get a proper latch? And how can I comfort sore nipples? When your little one is hungry, they'll give you certain cues to tell you it's time to eat. If your baby's opening and closing their mouth, sticking out their tongue, or sucking on their lips, fingers, toes, or clothing, you can be pretty sure that they're hungry. They might also do something called rooting, which is a natural reflex where a baby will turn towards their mother's breast after she strokes their cheek. Your baby may also start acting restless or squirming around more than usual. If your baby's crying, it's actually a late indicator of hunger. Your baby will know how often they need to feed. You just have to look out for their hunger cues. In the first few days after birth, they may want to nurse as often as once every hour. Let your baby decide how long they need to nurse for to make sure they're completely satisfied and full. As a rule of thumb, babies shouldn't go longer than about 2 to 3 hours during the day and 4 hours at night without a feeding. But remember that nursing isn't just for babies, it's important for mom too. Frequent nursing boosts milk supply and helps minimize breast engorgement. Breastfeeding is completely new for your baby and maybe even for you. So don't worry if your little one has trouble latching on the first few times. Once you're in a comfortable position, gently bring the baby to your breast and let them latch on. You want to make sure your baby takes a full mouth to the breast and take as much of the areola as possible, not just the nipple. Your baby's chin and nose should be resting against your breast and their head should be tilted back just a bit. You should be able to hear them swallowing, and that's a good sign that your little one has latched on properly. The skin on your breast is very delicate and it's normal to experience some soreness after breastfeeding. Your nipples can easily become dry, cracked, irritated, and even infected. Luckily, relieving the discomfort is easy. After feeding, pat your nipples dry with a clean, soft cloth to soak up any leftover moisture, and let your breasts air out every so often to avoid irritation. I also recommend applying a nipple cream every day, like the Nursing Comfort Balm, which is perfect for soothing cracked skin. I personally like this product because it's natural, lanolin-free, and uses only food-grade ingredients. You want to make sure you use a product that's been tested for both mom and baby safety.